This is an Atlas Injury Prevention Solutions presentation, Surgery versus Physical Therapy. Which is best for you and your medical problems? It can be hard to figure out what treatment option is best for you. Every medical issue is different, and surgery and physical therapy can be appropriate for an individual in different situations. So how do we decide? Considerations that need to be made when making a treatment decision are: what is the evidence between different treatments? What are the risks for each treatment? What are the rewards when considering each treatment option? And what are the costs for each treatment? Let's apply these considerations by using a scenario in order to best help determine what an appropriate treatment might be. So specifically today, we'll be looking at rotator cuff tears, which is a pathology that's both treated surgically as well as with conservative care. Quick review of the rotator cuff tear. Rotator cuff is a group of 4 muscles that help to stabilize the shoulder joint. A tearing of any of these muscles or the tendon of these muscles can lead to pain, discomfort, and loss of function. For a long time, the evidence has shown that surgical intervention is required to repair the tearing of the muscle of the rotator cuff. But with more and more evidence coming out, there has been a lot of comparison between surgical intervention and conservative care or physical therapy. And a meta-analysis, highest level of evidence, has found that there is very little difference long-term for the treatment of rotator cuff between the two treatment types. Next, looking at risks, surgery and physical therapy both come with the risk of unsuccessful resolution of symptoms or function, as well as further damage to the rotator cuff or surrounding anatomy. While surgery also comes with further complications during the process of the surgery, as well as pain medication abuse following. So looking at rewards, surgery provides conclusiveness around the diagnostic process, allowing the surgical eyes to view possible pain generators or things in that shoulder that could be functionally limiting the musculoskeletal system. Whereas physical therapy, one of the rewards could be the ability to continue with daily activities, as there's less downtime for recovery after a treatment session. Next, to compare surgery and physical therapy, that's very important, is cost. National average of surgery for rotator cuff repair is about $25,000. This can range widely given the fact that insurance pays out very different depending on the individual coverage. This also doesn't bring into consideration always the other things that cost money, such as hospital stay or the physical therapy that may come after the surgical procedure that's performed. Physical therapy in isolation also costs a little bit differently depending on insurance coverage, but typically is less than $100 a visit when insured, or about $250 to $350 without insurance. And this type of care typically lasts for anywhere from 8 to 12 weeks, but can last longer just depending on each individual case. In summary, every rotator cuff tear is different, but when comparing conservative care to surgical intervention, conservative care tends to have less cost, lower risk for serious complication, and has high quality evidence to show it's effective. Surgery has more of a diagnostic conclusiveness, as well as may be very appropriate for situations such as traumatic, severe rotator cuff injuries. As physical therapy and surgical intervention are just 2 treatment options for something like a rotator cuff tear, make sure to reach out to a healthcare provider to better understand the options that are out there for you. Increasing your knowledge base can help promote the best decisions and can overall improve your care for your problems. That's it for this presentation about physical therapy versus surgical intervention. Stay tuned for more educational pieces from Atlas.